Here we go. Thank you so much for having me here today at the Business Analytics Innovation Summit. What a wonderful opportunity. My name is Mark Ruffing. I'm going to speak to you today about two things that I'm passionate about. I have 20 years of experience in business analytics and how we're taking that knowledge and we're applying it to the organization through enablement. So, introduction to the Cleveland Clinic. The Cleveland Clinic is 22 hospital health system with 225 different outpatient centers, about $2.5 billion in annual revenue per year. We have about 300,000 inpatient admissions and observations on an annual basis, about 250,000 surgeries, and about 72,000 caregivers that we service. My team is helping to enable analytics for those 72,000 caregivers. The Cleveland Clinic is ranked #1 in Ohio by U.S. News and World Report. We're also several of our community hospitals, including Hillcrest, Fairview, and Akron General, are ranked in the top 8. We're also ranked in multiple specialties. So in heart care, we've been #1 in the United States for 28 years, and several of our subspecialties are ranked nationally as well. The Cleveland Clinic has a presence across North America. So within Ohio, that's our largest hub. We have multiple community hospitals and outpatient clinics. We've seen large expansion in our Florida region. So initially there was the Weston Hospital. Through mergers and acquisitions, we've added Indian River and Martin Health System, which are 4 acute care hospitals in total, multiple outpatient facilities. We also have a presence in Las Vegas. So there's the Lou Ruvo Center for Neurological Care. There's also urological and imaging care. We also have care in Toronto for Cleveland Clinic Canada, which is a feeder system for capitalized medicine and executive health physicals to our Ohio region. We also have an international presence. So our newest family member is Cleveland Clinic London, which is just overlooks Buckingham Palace. It's within about a half-mile radius of Buckingham Palace. It's a 180 or so bed hospital, acute care hospital, and a medical office building in London. There's also Cleveland Clinic Abu Dhabi, which is it's a very large hospital. So it's the scale of the Cleveland Clinic main campus. It's over a 1,000 bed hospital in Abu Dhabi. And that's more of a management consulting agreement to infuse westernized medicine within the United Arab Emirates. Together, this brings into the first globally integrated healthcare system. So presence in North America and Europe and Northern Africa, as well as within the Middle East and Asia. So what are we doing within the Cleveland Clinic to transform the way that we work? So we had a data governance office, and my team has joined this team to bring together data governance and enablement to deliver data as a service. If we were able to rebrand ourselves as the data enablement office at this time, we would do so, as governance can kind of have a constraining feel. And we really want to enable analytics across the organization. So how is our department structured? We have an overall program office that my senior director oversees, Kevin Mooney. And then there's a technical data governance wing that oversees the Informatica platform. That's what we're currently using. We're also looking at maybe transitioning to Purview over time. And this is called the Data 360 platform. And we have a group that does business glossary, metadata catalog, data quality or IDQ, as well as master data management. We have 2 different domains for that, provider and caregiver. I'm going to speak a lot about my team on the next slide. And then the third wing that we have is governance and cybersecurity interlock. So they use OneTrust system in order to do data privacy, classification programs, so identification of sensitivity of data across our organization and other components of cybersecurity interlock. My team is focused on data and analytics enablement across the organization. So for Tableau and Power BI, we are the product owners of those 2 products. We do both the Center of Excellence as well as the Community of Practice. So governance of the platform, the vendor relationships, best practices, a lot of design-based thinking resources so that people can curate and develop analytics that have meaningful outcomes. Under the Informatica platform, we focus on the community of practice. So we do all the outreach education for the Informatica suite of tools and really bringing together the community of practice. My team has several roles. So myself, I'm the assistant director. There's a program manager that helps to oversee predominantly the analytics platform, several enablement analysts, and then also systems administrators and business intelligence architects that help to transform some of our ETL processes and automation of the systems. The capabilities that we look for in students and people that are looking for jobs within our work stream, analytical skills, we're curating and working with the organization on developing analytics, communication skills, we're constantly in front of people and working on different projects and communicating with people. Technical writing, we still do quite a bit of technical business analytics. We get pulled into things, or helping them to write requirements for developers. Design skills, so developing analytics that are meaningful and interpretable, and then self-enthusiastic and motivated. So how does this come together? How do we bring together data governance and enablement under one roof? So we try to balance agility and control, so we want to make sure that people can agilely develop and curate content that's meaningful to the organization, but at the same time govern those analytics, make sure that they're standardized, that the data is curated. And so what we do is we identify roles and assess skills across the organization, try to match training programs with people's needs and the different technical platforms that we're supporting. We enable the analytics capabilities and the data capabilities, and then over that, govern the platforms. So there's best practices, standard operating procedures, application oversight, data security, and out of that, the outcome of that is analytical outcomes. So our objective is to turn information into insights. Our workflows are very important. So when you're servicing 72,000 caregivers, you have to have a structured workflow. So we have a very simplistic form in our enterprise analytics portal, and it's designed to be simplistic. If it's not a JDI or Just Do It, our intention is to call back the customer, try to work with them, and figure out what they're trying to create. The objective is not for us to do the work. The objective is for us to enable them to do the work. We also leverage Jira, and we put all of our work within project and maintenance forums within Jira. All of that goes to a Kanban board. So every day we huddle around a Kanban board and we talk about what matters most to the organization. We prioritize our backlog, our to-do, our in progress, and we work on our throughput and WIP through our Kanban board. All this rolls up and as we try to identify what matters most based upon our objectives and key results. So there's a waterfall approach where the executive directors down to the senior directors down to myself have a listing of objectives and then measurable key results. And some of these are, to have reoccurring enablement activities. Some of them are usage stats across the platform, and some of them are, some of our strategic initiatives. Each of the team members has goals. They identify their personal development goals, and then we build out roadmaps. This is a look at one of our business intelligence analytics roadmaps. A lot of reoccurring activities as far as objectives for enablement. How many workshops we're going to have, how many user group meetings, things alike. Methods of communication. So we use a lot of methods of communication. We try to use as much living documentation as we can. We try to curate a community of practice and have people engage with each other. So I'm going to show you our enterprise analytics portal in 1 minute. We use Jira as our primary portfolio management system where we communicate both with ourselves and tag people and provide updates on their requests. We have intranet sites, so we're currently using Jive, which is rebranded as Connect Today, which is amazing, and I'm going to show you that in a second. We also partner with Microsoft, and through our cloud-based transformation that I'm going to go to speak about, we use Microsoft Teams and channels. We also have user group meetings, liaison meetings, and surveys. We do try to limit email as much as possible. I often tell my team members, try not to say just email me. When you're servicing 72,000 caregivers, we need it to be into our structured workflow. Also, email chains get broken. You don't know exactly who can see it. It's not searchable. So we try to put everything that we can in searchable locations for people to interact and obtain that information. This is a look at our centralized enterprise analytics portal. It's extremely important in delivering content and having a central location for people to ask for assistance, to do security automation, request service. What's really helpful about this is we support multiple analytics platforms. The end users don't need to log into one platform or another to obtain their analytics. You go to one location for web applications, dashboards, data marts, reporting, all their service needs. This is a look at one of our connected A pages, which is on a platform known as Jive. End users are strongly encouraged to ask questions, start discussion, share an idea. All the text on here, all the documentation that is uploaded is searchable. It's very much like if you go out and you do a Google search for your favorite SQL query, trying to find an answer, you can find this information online. And we really, ask that people go out and share and collaborate. There's lots of wonderful living documents that are all searchable. You can register for classes, all that kind of things. On those connected A sites, I highly recommend, if you were to build intranet sites, build them based upon product or domain. Don't do them based upon departments, because departments change and organization structures revise. So why should you enable? Why should you invest in enablement? People are being asked to do more and more with data. So 75% of people are asked to read data in their job, 65% to interpret, and 63% to make data-driven decisions. People also have significantly more access to analytical tools. So 67% have access to BI software, 75% to analytical tools. However, there's a giant gap in people's ability to leverage these tools. So only 21% of employees feel that they're confident in their data literacy skills, and 25% feel fully prepared to use data. Lastly, as we address the Great Resignation, 80% of employees suggest that they would be more likely to stay with their current company if they offered data literacy and skills training. According to research from the Data Literacy Project, enterprises that have higher corporate data literacy scores can have between $320 and $534 million in higher enterprise value. This is impacting your employee morale, their ability to do their job, and your bottom line. So what is data literacy? Data literacy is a big buzzword right now. I love data literacy. Data literacy, simply put, is the ability to read, write, and work with data. So can you read data? Can you communicate or work with it, create ETL processes, store the data, and communicate? And through communication, you need to create visualizations and analytics that are interpretable and meaningful. What are some barriers to data literacy? Poor data quality. So you need to have accurate information in order for people to make meaningful insights of their data. Data silos. People become very protective of their data. They create silos all over the organization. The data, it doesn't relate to each other. It may not join. The information may be measured differently. It's also not as robust or as large in context. So the next one is missing context. If you have a lot of different siloed data stores versus central data repositories that are robust and wide, if people have, the wider the data assets, the more meaningful insights you can get out of the information. Lack of data culture. It's very important for your leadership to have a data-driven culture to make sure that they're making decisions out of data so that people, focus on data literacy. The last thing is lack of literacy focus. So investing in enablement programs and, making employees, giving them opportunities to train up and learn more about data. So what are some of our training delivery methods? And I'm just going to speak about some things that we've done and how they've been effective. So in-person and virtual training, we're switching a lot of our training, as many other people are, to virtual. It's been wonderful. When you have a global company, it allows people to, attend your events more frequently. Workshops, visitathons, hackathons. We have intermediate workshops where we create training guides. We record all of them so people can do it for self-study on their own. The Cleveland Clinic has a great job shadowing program to align mentors to employees to the employees' interests. on-the-job training and office hours. We open up our office hours to everyone in the community. You can dial in and listen to other people's questions and use cases and watch them work through their use cases. E-learning modules, we have a learning management system where we curate a lot of content. And off of that, we do quiz training and game-based training. So people attend the e-learning modules. Afterwards, you do a quiz. We have podcasts, and we record a lot of our videos, and they're available for on-demand replay. Out of this, we develop learning paths, and I highly recommend this. So what I find is when managers and directors across the organization come to me and they ask, how do I develop my team more thoroughly? Oftentimes I pop up a learning path. I say, well, what has your team completed to date? Well, they went to intro training. Okay, well, here's the next steps. Let's have them go and do the LinkedIn learning modules, have them log into our My Learning module and do that. And then after that, let's schedule reoccurring check-ins for their initial use cases. This is the most critical piece that I find. So we can work through their use cases, understand their business model, and make sure that they're applying our standards. So we are going through a large cloud-based transformation right now. In healthcare, the cloud-based vendors historically weren't willing to sign BAAs relative to PHI. That has changed over the last few years. We now have a Chief Digital Transformation Officer, and a lot of our on-prem technology we're evaluating relative to how will we transition this to the cloud. So I'm going to help with the transition of Tableau into Power BI. Now, we might host both of those for a while. Informatica, we're looking at Purview. Our first big move is going to be, we're going to take Teradata and move it into Azure and use Teradata Vantage. One of the risks that we've heard from a lot of people is you open up gateways and you let people move data into the cloud on their own and start building analytics off of that. Have a defined data strategy. And our strategy is going to start with moving our EDW into Azure and then trying to build pathways for data into the analytics platform. So our Power BI roadmap, how we started this was we started with greenfield use cases. And how we defined greenfield use cases was any data or technology that's native to the Azure cloud. So we have a CRM Dynamics module that has a ton of different data assets. We're using chatbots, web trends. So we're identifying those use cases and working through those to learn from those. We're going to continue to work through those as our EDW goes to the cloud and build up our best practices, our standards, our community of practice, our intranet sites, all that kind of good stuff. What we perceive that we'll see is self-service adoption to grow over time. So our involvement in the platform will reduce as federated development increases. What we saw with the Tableau platform is initially we had for every asset that we curated, there would be one asset curated across the organization. With Power BI, and then over time, now it's 6-to-1. So for every asset, centralized EA builds, 6 times the number of federated assets are curated. We anticipate an even stronger development curve to happen with Power BI, given that we now have 1,000 people across the organization developing their own analytics and reporting. So a couple of success stories. Philanthropy Analytics was one of our first strategic business partners on the Tableau platform. They really helped us to build up our community of practice. So they went out, they built a bunch of reports, they went to our user group meetings and spoke to them. They built over 170 different Tableau dashboards. They have 180,000 different hits in the past 4 years, and they're managing over $400 million in commitments on an annual basis. The process before and after Tableau, so they have 3 primary work streams for their reporting: locating donors, calculating fundraising metrics, and pulling financial data. Each of these work streams would take 2 to 4 days or 2 to 3 days to curate a report and deliver it. Afterwards, the user logs into Tableau, they pull the information that they need in 1 minute. Investment Analytics was another great strategic partnership. So This used to be farmed out to portfolio managers, and in 2016, 2017, the entire investment portfolio of the Cleveland Clinic, $13.3 billion and $1.4 billion in pension plan, is now managed in-house. So this was a partnership where the Enterprise Analytics Central team did the data warehousing of all the ETL field feeds of our portfolio, and then they did the reporting and analytics, and we partnered with them to train them up on how to build those. They also built a robust web portal for their reporting needs, and all these analytics are leveraged on a daily basis to make meaningful insights into the investment portfolio. Lastly, the Cleveland Clinic won the International Institute of Analytics Annual Award for our response to the COVID pandemic. We partnered with institutes such as respiratory emergency services and lab services to curate analytics for meaningful analytic insights. So what are some of the lessons learned for enablement? Start small and scale up. So don't try to accomplish everything all at once. Like we're doing with our greenfield use cases, identify some use cases, learn through that process, standardize your processes, govern them, and continue to extend your community of practice. Enablement is a team sport. Don't be overly protective of your content and your platform. Your federated partners are your greatest assets in the organization. You're not going to be able to do it yourself and service the analytical needs of the community. They know their business model. Also, leverage your vendors. They have great resources available. They have education resources available. They're willing to sponsor your events. Partner with them. Align business needs to skills training. So identify the skills that are required for your organization, mature your skills training as your organization matures on products, and adjust. So when you start to embed new technology into your platform, be able to create new skills training. Assign business relationship leads. So we assign different enablement analysts to different institutes and divisions across the organization. They start to become familiar with their business line, how analytically mature they are, where they are in their analytical journey, and they help them curate their analytic content themselves. Standardize processes for assistance. So avoid the, hey, just email me and we'll help you out concept. Make sure your workflows are standardized. Make sure your team knows how to support analytics in your community. Create valuable data assets. You need to have certified, high-quality data assets that are extensive so that people can build meaningful insights. Ensure support for federated assets. So we've gotten burned a couple times on this. Make sure that your federated teams are scaled up to support the reporting that they create in case of attrition. Make sure they're also, standardizing their work and documenting it. Balance agility and control. So you want to use governance, standard operating procedures, but you also want to allow for agility. So enable your federated teams to curate and develop analytics. Lastly, measure success. Create objectives and key results. Measure your success based on your usage metrics, and always continuously reevaluate, as well as value feedback from your community as far as what matters most to the organization. I thank you very much for your time today. I really appreciate being here. It was a really great experience. Thank you so much. Yeah, sure. There you go.
Thank you, Mark. We want to make sure that we open up the floor for questions. So if you guys have any questions that you would like to ask Mark about the presentation, their enablement journey, please raise your hand and we'll make sure to get a microphone out to you. We have one in the back, please.
So I'm Bill McHenry. I'm a professor here and of management, and Susan Lowry and I are also doing moderating. I'm just going to let Susan introduce herself.
Hi, I'm Susan Lowry, as you just heard. I'm on the CETA board, and Bill and I are going to be asking questions as well as helping moderate some of the ensuing discussion that we've been having.
So we don't yet have an audience question, is that correct, or we do? Oh, okay, so, and do we have a microphone there?
Hello,
Okay.
can you hear me? Yeah.
All right.
Thanks, Mark, for the talk. That was really interesting. Just jotting down notes pretty quickly over here. One quick question that I have for you. So Michael Emery, Bridgestone Credit. Just wanted to understand a little bit more about how you got to the enablement path. Obviously, Cleveland Clinic, a really large organization.
Right.
You have a lot of different divisions, locations, et cetera, employees. Was enablement where you started, or was it starting as a COE, or was it decentralized? Or can you talk a little bit more about how you got from an analytical perspective, organization-wise, to the point in which you were focusing on enablement and, putting that power into the end users within the businesses?
That's such a great question. So I started in technical business analytics, and we curated a lot of the reporting as well as the data assets. And what we found was historically people were more kind of coveting of their content. We didn't share a lot of our reporting. It was, enterprise analytics will own the reporting, and they're going to address the reporting needs of the organization. Well, guess what? We couldn't. You can't address the needs of all your business lines for 72,000. We also don't know the business needs of 72,000 different institutes and departments. We're not the analysts in those federated teams that are working with their sponsors on a daily basis. So the intake, the volume was just too much to manage. We still do create some enterprise-wide reporting, so there's some aggregated metrics, and information that's available for executive-level reporting, but what we found was, and our vendors assist with the development of the program, is you can really share analytics and you can really benefit from the federated partners building up their own portfolio of work. And it's gone from, us building one asset to the organization building 6 times the amount of assets. And the assets that they're building are really meaningful for their business line. So it was really a strategic determination, and we found the right individuals to help lead that journey. Thank you.
Great, thank you. I'm going to jump in with one question here. What is a reasonable goal for enablement? Is it 10% of your knowledge workers in the first year, or 50% in year 2? And how do you measure whether or not someone is actually enabled, quote unquote? What's the end game of saying they've reached that point?
I've really enjoyed the growth that we've seen across the organization. So I spoke earlier about, it was initially 1-to-1, right? We would build one analytic and then they would build one. And I think that a projection curve is great to look at. So with the Power BI platform, I imagine it's going to be 1-to-1. And I'm hoping that within 2 to 3 years, we can get to 10-to-1. As far as how many that we have. We also look a lot at our usage metrics, and we try to identify gaps. So we look at what institutes and departments or divisions are curating analytics and having usage tests come out of there. And then we try to partner with the groups that don't yet have federated assets developed in high usage metrics, and then build up the culture there as well. So we talk to their sponsors, and their senior directors, and start to build up their analytic shops.
Okay, so there is no standard by which you say a person is enabled then?
What we notice over time, it's really a feel thing, right? So when you start on a learning path and a journey. You start to have reoccurring meetings, and you start to see that they're starting to become self-sufficient. And then over time, the reoccurring meetings, they might not have a question, so you end up canceling the meetings, and then they're off and running, and then they come back when they have a specific use case, and we start to discontinue those. So, after 6 months or a year, and they're off and running, then we stop and we say, okay, throw a ticket in. Anytime that you want to get together, we're happy to meet up, or stop at our office hours, come to our user group meeting and present. But you just start to see them kind of fly off on their own, and then we're picking up the next group and bringing them on.
Great. Do you have a question?
Any questions from the audience? Over here.
Yeah, I think in the middle here.
Oh. Can you talk a little bit more, how do you govern/enable the analytic assets built by your business partners?
Yes. So we set up standards across our analytics. A lot of our data is very structured. So we have an EDW, and we govern and we certify those assets. So we bring them into Axon, and we, curate them. We also, have a lot of check queries and IDQ processes to validate the information. On the analytics side, they are responsible for their own reporting data quality. We do have a central repository of metrics and ways that you should calculate things, as well as we have standards around reporting. So we suggest here's your best practices around data source development in the analytics platform. Here's the ones around dashboards. So that's how we provide insight, but we don't necessarily certify their analytic assets outside of the data assets. They're kind of responsible for their federated reporting.
I think there was a hand here.
Other questions? In the back?
And also here, in the center here.
Thank you. How are you adding a layer of predictive modeling to what you're doing at this point?
Yeah, we have an advanced analytics team that's outside of my team. So we have a bunch of data scientists in centralized enterprise analytics, and there's also now data scientists from around the federated teams. I don't work personally in the predictive analytics space outside of, sometimes we take those models and then we embed them within the business intelligence analytics. So we have started to build data science a shop both within enterprise analytics as well as within different federated partners. And sometimes we help to build the reporting layer over it, but I don't actually do the data science part of it. But thank you.
Hi. One thing you didn't really touch upon was what data you're actually getting involved with. I can imagine there's all kinds of data throughout the clinic. Do you get very much involved with clinical data, things out of Epic and things like that? And how is, if you do, I'd be very interested to find out how you've been able to drive adoption to people in the clinical space who typically have very little time and often sometimes very little patience for trying to get at data. They just need it when they need it. Just very interested to see if that's a space you're operating in and how you conquered that problem.
That's a great question. So personally, I used to work a lot with financial data because enterprise analytics was spun up under finance. I love that has changed because I knew a lot about those data sets. I helped to build them all. Through our partnership with our clinical business intelligence team and the development of our EDW, as well as working with all of our federated partners, now we're working with buildings and properties in the 6 million square foot of data that they're managing. We're working with a lot of clinical data as well. We work with supply chain data. So the way that we do it is we have an enterprise data warehouse where we have SMEs to embed and create that data. We have ETL feeds directly out of Epic on a nightly basis. And then we have different domains directly in that EDW. So everything's related. It's very large in expansion. So there's expansive. There's general ledger data, there's supply chain data. You can relate it all. It's all in one place. And then the federated teams work with their sponsors in order to drive, what matters most. And that's where us building the analytics versus the federated teams building it, respiratory institutes' needs are much different than emergency services. So each of those teams have shops and they work with their sponsors and they say, what matters most to you? And we help to deliver those analytics, but they're the primary content creators.
So you mentioned in your presentation that there was a barrier with not having BAA agreements. Yeah. And so for folks that are in the room that don't work in healthcare, can you talk about that a little bit and why that's so important?
Yeah, so the Cleveland Clinic, historically, what we've done, and a lot of healthcare providers, is we have a Brecksville data center. There's also one in Florida, and we have this really robust on-prem analytical suite of tools. A business associated agreement is that the cloud-based vendors are taking on the responsibility to have protected health information in the cloud. A lot of the commercial industries have already migrated to cloud-based technology, but they were not willing to take on that responsibility. If there's a data breach or a data leak, it can be thousands and thousands of dollars that you have to pay. Plus, you're also responsible for the privacy of the patient. So now that the business associated agreements or the cloud-based vendors are PHI compliant, we're able to transition. And what a lot of the vendors are doing now is their on-prem offerings are becoming so cost prohibitive, And then you have to take on, the cybersecurity and the information management and having all these shops that it's just so expensive that the timing is great to move to the cloud. Does that make sense?
Oh, yeah.
Yeah.
Absolutely.
So one of the things that I've seen is that a lot of times large companies that are global, they do a great job with their their local people. So the Cleveland people are probably leading the way, but there's a lot of a lag in adoption in the satellite areas. And I'm wondering how well are you doing with the Abu Dhabi in particular in getting them on board and doing their training?
So Abu Dhabi is separate from that perspective. Because of the agreement between us and the United Arab Emirates, it's mostly on the clinical side and infusing westernized medicine into Abu Dhabi. So we can't really see their data. They can't see our data. We can share workbooks that are de-identified, but our largest merger and acquisition activity would be London, which we spun up. Now they have GDPR restrictions, so a lot of their data has to be federated and separate as well. Florida, though, the expansive growth that we've seen there, as well as Mercy and Union Hospital, those were both added recently. We're kind of trying to rapidly ingest information into a central data warehouse, not create the data silos, which then enable them to leverage all our curated assets. So we've really ramped up our ability to get them both on our electronic medical records where possible. A lot of the merger and acquisitions are going live on that, as well as getting as much data as possible into our EDW so that we can partner with them without doing duplicate work. So a lot of it is driven by the data while we teach them the technology.
Gotcha. So did you start with a data ops and governance strategy first before you started implementing all this, or are you doing both in parallel?
I would say in parallel. Yeah.
Oh, really?
A little
Learning
bit.
as you're going.
Yeah, we are. Yeah, so, we do have a data-first approach, right, in federating the analytics. And the governance is, coming into fruition, into color a little bit more. We've always had the data and analytics component to it. And so we've recently launched the Informatica suite of tool, and the data governance platform and the shop has been something new to the organization, right, in the last 3 to 5 years. So yeah, it's newer. The concepts are newer. We've always tried to certify and make sure our assets are good, but we've never had a fully vested data governance concept in the tools. So even the Informatica suite of tools, and that's why my team is, focused more on enablement, is we're bringing in more and more tools, and we need to support those. So all the Informatica, the Power BI, all the Microsoft stuff.
Last question for me. Do you struggle finding resources and top talent to help you?
Yes. Yeah. I mean, I've been very fortunate personally, maybe because, I don't know, I'm a likable person during the interview. No, I have great team members. 2 of my team members are here today. But it is, retention is challenging because you train people up and they're also exposed to the organization. They work with everybody across the organization. Part of our mission, though, in enterprise analytics is to infuse analytics across the organization. So, we bring people up, we train them, and some of the people go to other parts of the organization. Some people go to other organizations. We prefer if that doesn't happen. It's much more preferable if, they stay within the organization and help out some of our federated partners. But a lot of people do stay and grow and develop, like myself, with 20 years of experience.
Yeah. So thank you very much. I think I'm going to turn it back over to Abdu in just 1 minute, but I want to say one takeaway from your presentation. I think, the overall is the idea that enablement doesn't just happen by itself. So you think of the totality of everything that Mark has shared with us today about what they're doing, and it really is massive because every point on every slide that he had, he could go into in great detail of things that they've done with their organization. So it's really massive what they've done and what they've accomplished. And the takeaway is that enablement has to be curated and it has to be managed. And so for, I think, everybody in the room, it's something that we all need to think about no matter where we are in our analytics journey. To take the next step forward, we're going to have to do more curation and more management. So thank you very much, Mark, and I'm going to turn it back over to Abdu.
Thank you so much.